Yeah, so we have a special guest today, Dr. Sunita. Thank you so much, ma'am, for coming in our IHW podcast
Thank you,
on World
Samiksha.
IVF Day. So, ma'am, can you please walk me through your journey?
Yeah, well, Samiksha, I have been born and brought up in Delhi actually,
Yeah.
and all my schooling, my college, I am a pass out from Lady Harding Medical College, and after that, I did my post graduation and residency in University College of Medical Sciences, GTB
Hmm.
Hospital. And then I happened to go to Chandigarh for good 10, 11 years. I was assistant professor in Medical College, Chandigarh. And from there, actually, this was always a dream to establish an IVF unit in Medical College, which somehow did not happen. And then I went to US for almost a year for my fellowship in IVF. And I did my fellowship from DY Patil University as well as in India. So this is how this you can say that Kia of IVF, which was there fruitfully. It happened back in Delhi, and now I'm heading IVF Center in Bloom IVF Center, Fortis La Femme Hospital, which is in South Delhi, and I've been there for last 12 years and serving my patients since then.
So, ma'am, nowadays we are seeing has been become a trend for girls to freeze their egg. So, is it really right, or someone should go with that, or what's your views on that?
Okay, so thanks for this question, because there is something called as biological clock. So, what is biological clock? It means that as the age of girl advances, the fertility potential as far as number of eggs and quality of eggs is concerned, it declines. Not only that, as the age advances, there are chances of genetic problems in the eggs, and that's why this is something called a social egg freezing, that you want to freeze your eggs because you don't want to become a mother right now, because there are so many things a girl may have to look forward to. Maybe her career, she's not getting right partner, all those things. She wants to postpone her pregnancy for a few more years. So this is actually a great option. And let me tell you that the awareness about fertility preservation is actually on the rise. And so many girls are coming to us. I'm getting at least 5-6 girls between 30 to 35 who are coming to me almost every month for egg freezing at my center. And it's a good thing, and people should know about it. That is more important. And this fertility preservation is not only regarding the biological clock. Sometimes there are pressing situations like somebody suffering from cancer, going for chemotherapy. So what happens is the ovaries, they are knocked down. Their potential decreases to produce eggs after chemo and all. So it's a good option. It's a very good option, which all of us are supposed to discuss with our patient whenever there is cancer or some other condition like endometriosis and all, where we prefer that girls should come and freeze their eggs in time.
Yeah, I think it's a good in that way, but there is one more thing which I would like to mention, like people who can conceive naturally also. Now they also want to do IVF. So how do you convince and
Yes. So see, there is a right age to everything. You rightly said that. So whenever couples they come to us, we convince them that the best thing is to conceive on time. But sometimes you will agree, when you are looking forward to achieving your goals in your career, you feel no, for next 3 years I can't become pregnant. You're already 34, 35, and the genetic problems in eggs are going to increase too much, around 38, 40. So then it is definitely a good option in those cases. But yes, we should go by nature. That's the best. So first thing is convince your patient that they should conceive well on time. They should complete their family ideally before 35 years of age. If you want 2 kids, you should have 2 kids by 35. That's the most ideal. But unfortunately, this ideal thing is not happening in our country of late.
I see there is trend going on to go for IVF and all. Those who can do naturally as well.
Yes, absolutely. See, IVF is not a cakewalk. I always tell my patients, whenever they come to us, first thing is just see their case, whether they are able to conceive naturally or not. Sometimes there are clear-cut indications like blocked fallopian tubes. There you can't help. Person has to go for IVF. But if everything is fine, there is no male factor, there is no female factor, best thing is to conceive naturally. Nothing can beat nature, that is for sure.
So thank you so much, ma'am. It was indeed impactful discussion. So I would like to give you a short brief about for our viewers as well.
Yeah, well, so I will say, as Samiksha just now said, that it is always better to conceive on time and complete your family. But in case, because of any reason, you're not able to plan your family right now, then at least know about fertility preservation. Consult your IVF fertility specialist and know more about it. And don't be, afraid of the things. Don't take it as a taboo. IVF is not a taboo anymore. Now the awareness is increasing. More and more people are coming forward. And sometimes there are indications, as I just said, blocked fallopian tubes, where you can very well conceive with IVF, even if your both fallopian tubes are blocked. So don't be afraid of this particular treatment. Go forward, meet your fertility expert on time. So on time is very important, rather than, spending years and years waiting that something will happen, some miracle will happen. Consult your doctor on time. That's most important.
Thank you so much, ma'am. Thank you so much for coming
Thank you,
and
Samiksha,
giving
for
your
having me.
time.
Thank you.
Thank you.